Welcome back from our brief, but at least a little bit of a fall break. We're on to learning unit number 8, which is on physical health. And I know there's one group that is looking at physical health for their health promotion program. So by the end of this learning unit, you're going to be able to describe key aspects that define good physical health and the benefits associated with physical health. And you're going to, within your discussion board, propose ways to identify and address barriers to physical activity that may be present in different age groups and in different built environments. So we're going to be talking about built environments. And for the definition and information about that, that is in page 151 of your readings of your text. And we're going to look at different strategies for promoting physical activity across the lifespan and with diverse populations, and analyze Healthy People 2030 physical activity objectives. So you're starting by reading chapter 6 in your text. And again, I ask that you this text is, the chapter is a little bit lengthy and some of it is more common knowledge. So when you get to a section that is something that you already know, of course you can skim that. I do want you to read, and it's important to read the chapters, but I'm also going to help you focus on some of the key concepts that we need to look at. So you're going to review the posted content here. Remember, this is now topic number 5, which is due at the end of Learning Unit 8 for your group project to explore and then synthesize, put together evidence from the literature to support the need for your health promotion group. You can use your group's collaborative document, Zoom, whatever you've been doing as far as getting together with your group. And you're going to do your discussion board post, and I think I am changing that so that there is not a reply, so that it won't be due until Sunday. So what you see right now is accurate, but in the discussion board, it says something different. So Unit 8 discussion board post, just the post, no reply. And so therefore, because you're posting and nobody has to reply, it's due by Sunday evening. And I ask that you complete our midpoint survey. Very simple and brief, but it's not required. It's not the full idea survey. It just gives me some information so that I can actually look at your feedback and look at ways that I can improve this course while you're still in it. Why should you have the next student group benefiting from your feedback? Let me know how we can improve so that it impacts positively on you. So we've been on Healthy People 2030 before. What you're doing is you're going to this link, which brings you to physical activity, and you're going to be looking at the objectives from the areas of adolescent, child and adolescent, or older adult that are listed under this physical activity objectives. And you're going to make sure you check out the evidence-based resources, as I'm hoping that you're going to be citing one of the sources in your discussion. So if we go on to this site, physical activity, you just click on, you can see there's just some basic information here about physical activity. And you can see that we're not doing very good. The objectives that we have are, getting worse in many ways. So I'll let you look through. But the ones that I ask you to look at aren't these general ones. What I'm asking you to look at is something that's age specific, because you know how our populations, we narrowed down our populations for our health promotion programs. So I want to also narrow down physical activity. There's 3 objectives under adolescence. And then if you go to child and adolescent, you'll see some more physical activity objectives. And then if you keep going, the last section, the third one is older adults. So you're going to choose one. So if you choose increase the proportion of kids 2 to 5, that's okay. So we're looking at a specific population of children who get no more than 1 hour of screen time a day. So they want to increase that. They don't want kids 2 to 5 years old being on their electronics more than 1 hour a day. And that now we're seeing it's getting worse. So when you click on and I know we've been here before, but you see some information, there's detailed data, and there's evidence-based sources. So kind of look through this information, and the reason you're doing that is for your discussion board. Here's the midpoint course survey. You click on it, looks like a test, but it just asks you 3 basic questions. What's going right? What could we improve? So it's just very objective. Again, I just ask that you do that. It's not required. There's no points associated. Here's your group project. I don't have to tell you more than I did already. Your discussion board post is something that you can read kind of this intro paragraph here. But what you're doing is selecting one of the physical activity objectives that I just showed you, right? It was either adolescent, child then adolescent, or older adults. But what you're going to do is post a short synopsis of the barriers that may be associated with this age group. Barriers such as technology or especially built environments, and methods to remove these barriers or ways for nurses to improve patient engagement. And then you're going to not respond to one of your classmates. So I will be taking that off so it's clear for you when you do this. But let's talk about built environments. Please make sure you're reading pages 151 to 153. And built environments, what are they? That includes all spaces, buildings, objects created or modified by people, such as homes, schools, workplaces, parks, transportation systems. So built environments can hinder or facilitate physical activity. And I want to give you an example. My son lived in Arlington, Virginia. I've got a map here of it. And so this is Arlington County in Virginia. And you can see Washington, D.C. is right next to the city of Arlington. It's a beautiful city. And what you see is this is the Arlington National Cemetery. You've got the bridges crossing over into Washington. But what you're looking at is a bicycle map. People also, these pathways have been created, and they're wide. They're at least 6 feet wide. They're paved, they're maintained, they're plowed. They're incredible. And they go through areas of nature. So you're also experiencing the beauty of nature as you run, or as you walk, or as you bike along these paths. And some of them you can just see easy, medium, challenging, but they're everywhere. So my son lived in an area that he popped onto a path 2 houses down from his little residential section of Arlington. And he was able to go all over, including going into Washington, D.C., crossing the river and going into Washington. It is beautiful. Sometimes there's restaurants along the way that you're actually walking into from the path instead of driving. You could get into some of the villages. You can get to the metro stations to take you further. Truly incredible and beautiful. So that's the built environment of Arlington. However, what the barrier is the cost of living to be in Arlington, Virginia. I just looked up some of the stats. Housing, which is he was renting at that time, but housing is 121% more than the US average. The cost of living is 40% more than the cost of living anywhere else in Virginia. So if you want to live in Arlington, please note that it is gorgeous. It's a fantastic city, and it's a very safe area, but it's 40% higher to live in Arlington than the state average, and 41% more expensive to live according to the national average. So when you're talking about cities that are very poor and have those living below the poverty level, you're going to have a different built environment, perhaps one that is not safe. The streets, the transportation, the buildings, the schools, so I want you to really start thinking about built environment and how it impacts, and also technology. So you're going to have to look at some of the, extra resources, but I want you to really reflect on this and assure that you best understand that concept. So that's the key for this week. But please do look through the chapter 6. I didn't put a lot of other information because I wanted you to focus. So have a great week, and I'll be talking to you soon.